Welcome. Thank you for joining us virtually for a press briefing. My name is Kelly Chandler, the Public Health Division Manager for Itasca County. We are hosting press briefings in Itasca every other Thursday to address COVID-19 related issues and questions. And today we will discuss where we have come. We are 1 year into this pandemic, and we're going to hear from some of our partnering organizations and how they've adapted during this time to keep their programs safe and successful. It has been 1 year since we learned COVID-19 was in Minnesota. The first case was identified on March 6th of 2020. And it was on March 29th that we learned COVID-19 was in Itasca County. And what a year it's been for all of us. We've learned so much up to this point. We did not know in March of 2020 how COVID was spread. And now we know it is primarily airborne. We know that good hygiene, including hand washing, is important, but even more important is masking to prevent the droplets carrying COVID from spreading to others. A year ago, we didn't know that you could spread COVID prior to showing symptoms, and now we know you can spread it 2 days prior to becoming ill or even without showing symptoms at all. We were doing things like washing all of our groceries, and we were buying a very large amount of toilet paper. Some thought Itasca, which is more rural, would be immune to COVID. We are a mobile society, and rural America and Minnesota are not immune at all. We've learned how important broadband is and technology is to stay connected. And that's with our families and that's with our school children. We've learned so much more about how that work is important. And most importantly, we've learned how resilient our children, our parents, our families, and our neighbors are. And we're so thankful and appreciative for our community members who've worked so hard to keep everyone safe. You've worn your masks, you've foregone gatherings, holidays, you've supported our local businesses staying open by purchasing takeout versus dining indoors, and we appreciate you all so very much. Since March 29th of 2020, we have had 3,141 cases of COVID identified in Itasca. We've had 46 deaths, 221 overall hospitalizations, and 49 ICU admissions. And now, a year later, we have delivered 9,297 first doses of the COVID-19 vaccination. That is 20.6% of our Itasca County residents. We have reached 55% of our 65 plus seniors, and they have all started their at least dose 1, some have received dose 2. We finally can see a finish line, yet we're not there yet, but we're extremely hopeful, and we're also being careful at the same time. In Itasca, over the past 7 days, we've seen 29 new cases of COVID-19 and 99 new cases in the past 14 days. Our 14-day case rate per 10,000 as of February 27th is 21.7. And that's about where we've been in the last week and a half. Our cases have had an increase in the past 3 to 4 weeks where we've been down over the holidays. So we're still asking you in Itasca to stay careful and safe. We haven't crossed the finish line yet, so we still want you to wear your mask, stay 6 feet apart, and very important, stay home when you are sick, even with mild symptoms. Johnson & Johnson is a single-dose vaccination that has arrived in Itasca County this week. It was just approved with an emergency use authorization this past weekend. We are among the first in the country to receive them, and Grand Itasca Clinic and Hospital was the recipient. I will read a statement from them, although John Pedersen, their interim Vice President of Operations, is available for question and answer. Grand Itasca continues to work as quickly, efficiently, and safely as possible to administer COVID-19 vaccines to patients, starting with the most vulnerable populations. Over the last several weeks, Grand Itasca has administered a total of 3,300 doses of the Pfizer COVID-19 vaccine to healthcare workers and seniors. And this week, Grand Itasca received a shipment of Johnson & Johnson vaccines, which is a single-dose vaccine that was granted emergency use authorization last weekend. The Johnson & Johnson vaccine is said to be clinically equivalent to the Pfizer and Moderna vaccines, and in trials showed 85% effectiveness against severe and critical disease and 100% effectiveness at reducing hospitalizations. Limited doses of the Johnson & Johnson vaccine are available at Grand Itasca as part of a special vaccine clinic this Saturday, March 6th. Appointments are required for the Johnson & Johnson vaccine and are available to individuals 65 years of age and older. The 2-dose Pfizer vaccine also continues to be available to patients with schedules for appointments opening 1 week at a time on Mondays at 9 a.m. The Pfizer vaccine will also be available to patients 65 years of age and older when next week's appointment schedule opens. Appointments for all vaccines can be made on MyChart or by calling Grand Itasca's appointment line. Essentia Health, Big Fork Valley, Scenic Rivers, Walmart Pharmacy, and Thrifty White Pharmacy are vaccinating seniors over 65 right now. Leech Lake Band of Ojibwe also has opportunities for residents of Deer River, Ball Club, S Lake, Inger, and other communities within their reservation boundaries. Thrifty White received a large supply of vaccines this week, 1,200 doses, with appointments available by logging into thriftywhite.com, their website. You may call the local pharmacy if you're struggling to navigate the online registration system. And also Elder Circle is available to assist any of our seniors with any of the navigation systems for vaccination. Again, the finish line is in sight, but we're not quite there yet. Stay strong, Itasca. I will now introduce our speakers who have been invited to provide ways to support our community, to discuss their ways of supporting our community while they're still staying safe. We will have Melanie DeBay, Itasca Area Community Education Director, Brandon Bowstring, Powwow Coordinator for Leech Lake Band of Ojibwe, and Tricia Zimmerman, Development Director at Second Harvest North Central Food Bank. We will now start by hearing from Melanie DeBay, Itasca Area Community Education Director.
Good morning. I'm Melanie with Itasca Area Community Ed. And over the past 20 years, we have hosted the annual Itasca Area Children's Fair here in Grand Rapids. In the past, this event has brought in over 3,000 individuals at the IRA Civic Center for a day of fun family engagement. Families were able to interact with over 70 service organizations across the county at this event. In 2020, we unfortunately had to cancel this event due to the pandemic. This year, we thought we just can't let that happen. We know that with the governor's orders, we would not be able to hold this event as we normally have in the past indoors. So what we did, we brought a committee together to discuss how we could still make this event a reality in our community. We knew it had to happen. So we started with the why. Why do we do this event year after year? Why does our community attend this event year after year? Why is this event important in our community? Once we had the why, we started brainstorming ways that we could still fit into that why, while not encouraging gathering, keeping social distancing, and still providing a family engagement activity right here in our community that people wanted to come out to and felt safe to come out to. We thought about what our community has in our community for outside resources, such as our parks, our trails, and our beauty here in northern Minnesota. We knew our why was to provide a day that encourages families to spend time together while educating, nurturing, and caring for all children and families in our community. So knowing that why helped us come up with some ideas that were outside the box of our thinking in the past. We listed these ideas on paper. We listed the pros and cons behind all these ideas and how each idea can still provide access for all families, no matter what their current status is. Our committee landed on encouraging families to have a family fun day by participating in a drive-through event. Not the same as in the past. We then surveyed our past vendors, our service organizations right here in Itasca County. We asked them what they thought of the idea, how they could contribute. And we used a Google form to get their input and ideas for the event. We also looked at our past family events and what families have said about our past family events. We heard from families that they love the idea of picking up items that they can do with their family, free art kits to take home and create, free meals to take home and eat together, free books to read together, scavenger hunts to go explore together, dance videos to get active together, holiday projects that they picked up and created together, and affordable activities to do together was a must. So we also consulted with public health along the way to assure we are keeping health and safety at the forefront of all of our planning, which was a great resource. Using all the input, we started forming the plan to create an experience for families to do together, which we came up with a drive-through children's fair in a reverse parade style. So the parade, Children's Fair, will be held Saturday, April 24th, the last Saturday in April, as we have done in the past. We'll run the parade from 10 a.m. to 1 p.m. at the Grand Rapids High School parking lot, allowing families the opportunity to drive through the event, listen to live children's music while staying in their vehicles. The mini service organizations will be along the parade route in costumes or with large vehicles or fun displays, cheering on the families as they cruise along the route. The families will be able to drive through, see some of their favorite TV characters, such as Olaf, and Smokey the Bear will be there. They'll see some of their hometown heroes, such as firefighters and police officers, our doctors and nurses, police officers with their canines. They'll also be able to pick up activities along the route that are family friendly to bring home and create fun together. At the end of the route, all families will receive a free grab and go picnic lunch with a map of our beautiful area, including some of our amazing parks and trails, encouraging families to go outside and have a picnic together. And in case of rain, we're encouraging them to do this on their living room floor. If your organization would like to be involved, you can visit getlearning.org. Our vendor registration form is on our website, or call 327-5730 for more details. We're asking the vendors or the organizations who are involved to ways to be involved with the event is have a costume, a display, a large vehicle, or just come out and wave the families on as they cruise through the parade. It's an opportunity for us to celebrate the Week of the Young Child, as well as to show our support for families in our community during these trying times. Now is the time for all of us to celebrate our community and the families that we are working hard every day to support our youth across the Itasca area. So we hope to see you all there.
Thank you. And we will now hear from Brandon Bowstring, Powwow Coordinator for Leech Lake Band of Ojibwe.
Good morning. Ani and then away Maganug, Nisha Mikizu, Wagan the Goo, Brandon Bolstring, Indigenous Cause, Cha Cha Bonding and Dujaba Mikizi and Do Dame. I really didn't know what to say when I got the email from Alicia, and that was just to come in because like today, like if our tribal council voted on it, like today, we wouldn't be having powwows or anything like that. But I'm been told by a few of them that just wait off on that and wait until we're like getting vaccinations and we're at during the summer, and we should have powwows this summer. And I've been just planning on doing them, so I've started planning on everything, and I've budgeted everything. So what we're gonna do different is I think we're gonna probably limit vendors so we can get to because usually at powwows, like during our big powwows, you know, we have 30, 40 food and craft vendors throughout the powwow, and it just gets packed there. And then our seating, we're looking at maybe like doing it by families and, you know, first come first serve, and trying to limit people when they come in there. And we're putting a lot of money into hand washing stations and hand sanitizing stations and masks. And I think I'm trying to partner with IHS to see if they can do like if we can get those single shot Johnson & Johnson vaccination things, to have them set up one of their mobile clinics on or near the powwow grounds, so people who aren't vaccinated can get a vaccination while they're there if they would like to. But like I said, we're just like I'm trying to get a hold of them, and we're gonna do the logistics of all that stuff, because I don't know if you guys ever been to a powwow before. Like our ball club powwow, usually we get about 10,000 people foot traffic wise that go through the powwow and everything like that. And so yeah, we do have a lot of people that go to these things, and these are very important to our people, because, you know, it's about our culture and doing what we do. It's like our church, I guess you would say, like going to these powwows and stuff like that. And we haven't really discussed like if we can, should we have them or stuff like that. So it's you know, we're really taking this as precautionary as we can over here with regards to our powwows and everything like that. So yeah, that's where we're at, I guess.
Thank you. And we will now introduce Tricia Zimmerman, Development Director at Second Harvest North Central Food Bank.
Hi, everybody. Thank you for having me here today. Like Kelly said, my name is Tricia Zimmerman and I'm with Second Harvest. We recently had a virtual chef's gala that happened on January 21st. It was our 11th annual. And we got really lucky because in 2020, we slid right in before COVID really hit our area and before the governor shut our state down. So we were actually able to do an in-person event in 2020, which means that we had 300 individuals together at the Timberlake Lodge. We had celebrity servers that we auctioned off, and we were able to raise $80,000 in 2020 for our organization to help feed hungry people. I had really, really high hopes in August of 2021 that we could do something in person, whether it was a hybrid event or just something. And as time went on, that my bubble burst. And so we knew we had to do it 100% virtual. We knew that we wanted to continue to have our event. It was something that our community supports, that our community looks forward to. And so I started off by reaching out to individuals with knowledge that I didn't have. So I reached out to Anna and Elizabeth from Art Unlimited, who connected me with the Rife Center. And the Rife Center worked with us to pull off a 100% virtual event on January 21st. So we had to figure out how we were going to do that. What was that going to look like? And it ended up being where we continued with our celebrity kind of theme, where we had celebrity chefs that were zoomed in to the Rife Center stage, and we had people on the stage that were socially distanced, and it was all fed through YouTube onto our website, and we had donation platforms. And although we ended up having some technical difficulties, it ended up being an amazing event that was highly supported by our community, and we just raised over $65,000. What was really interesting is, we went into January knowing we were going to be 100% virtual, and about mid-January, the governor opened up our state a little bit, which meant that we could have technically had people at the Rife Center viewing our event in person. And that was a discussion we had as an organization and determined that we weren't going to go that route because we didn't want to invite people to our event and end up being a super spreader. And so even though we had an opportunity to do some of it live, we chose to stay virtual. And at the end of the day, we're so glad that we did, because we really wanted our community to stay safe while having an opportunity to help feed hungry people. So there was a lot of work that went into it. I don't envision that we're not going to have to continue to do something virtually in the future, because who knows where things are going to end up. But definitely a learning experience, and we were very grateful for the support and the help that we received to pull it off.
Thank you. And Melanie and Brandon and Tricia, thank you so much for keeping these events moving forward in a very safe and creative way. They're so important for our community, and having some sense of normalcy with safety in mind. So we appreciate you so much. We'll now open up to our question and answer portion of the press briefing. And again, we have John Pedersen, Interim Vice President of Operations at Grand Itasca Clinic and Hospital, available. We ask that our media submit questions via the chat with your name and the organization you represent, and we will ask our panelists to respond. We have Kathy Lynn from KOZY. Trisha, how are people able to access food currently?
So currently at the food shelf that's on site here in Grand Rapids, individuals can come right to Second Harvest and they can go to our food shelf door. There's either a doorbell or an individual will meet them outside. They'll receive a number and then the food will be brought out to them. So it's a curbside service. We're also doing pop-ups throughout not only our community, but throughout our region. So that's essentially where our truck goes to a parking lot. We put food in a line, individuals drive up and the food is put into their vehicles. So the schools, a lot of schools in our region also have school pantries. So if there are families in need of food, they can get food through their school pantries. The Kids Backpack program is still happening in a lot of schools. So children can receive food through that. And then the Nutrition Assistance Program for seniors, which again happens throughout our region. So from International Falls down to Princeton, they are still receiving food boxes. So there's a lot of different ways along with other food distribution through AEOA and other organizations in the community and throughout the region. So there's a lot of support out there for people who are in need of food.
Brandon and Melanie, did you have any other additions as far as food at all? In your areas? No. Melanie's shaking her head no. Brandon's on mute.
Yeah, when well, we used to, like, during our powwows, we'd have like a big feast, like a buffet style feast where we serve like food, like just all that stuff, like food and everything. But so anyways, but this year, I think if we do have our powwows, we'll be doing bag lunches because it'd be a lot safer and a lot easier for us to pass them out and not as much contact with the other people. So that's what we're gonna be doing at powwows when we feed people.
Great. We have Kathy from KOZY for Melanie. How much Get Learning programs this summer will still be virtual?
So this summer with community ed programs, we are trying and hopeful that we will have a lot in person. Most of our programming right now that the community is asking for is in person, and we are keeping very small class sizes. We're hoping for this summer to be outside a lot once spring hits, to have a lot of outside programming. But we do have about 20% of our programming this spring that is virtual, and we will still provide the virtual opportunities in the summer as well, hoping for not as many virtual and more in person, being outside as much as we can.
Great. Other questions from our media? We have Jennifer from ICTV. Can John talk a little bit about the vaccination clinic?
Hey, good morning, everyone. We are running our vaccination clinic, typically Monday through Friday. I'm assuming the ICT question is specifically about our Janssen clinic this weekend. So normally we get Pfizer vaccine, and we've been giving those allocations out. This weekend, we're doing a special event because we did receive that allocation. We're going to work Saturday from roughly 8 o'clock to about 4 p.m. We're going to give those doses. They are the single dose Janssen and Janssen. People can call our appointment line. They can access those appointments via MyChart, and we are scheduling those out. And I think we open the appointments up at about 9 o'clock, and I think within the first 30 minutes we were about half full, so they're filling up. And I haven't gotten the notice that they're full yet, but please reach out and call if you're interested.
Other questions? We have 6 minutes remaining. Other questions from our media? Okay, seeing none, we'll end a little early. Thank you all for joining us and for keeping our community safe. We appreciate you.
UPM leads the integration of bio and forest industries. Our constant aim is to produce more with less. That's what Bio4 stands for. Paper is true Bio4 product made of renewable and recyclable raw material. It remains sustainable throughout its whole life cycle. UPM Bio4, beyond fossils.